All right, everyone, ready for a deep dive today? We've got some really fascinating research to dig into on canine epilepsy.
Yeah, this was pretty cool.
Someone sent us this study and get a load of this title. Correlation between semiautomated magnetic resonance imaging volumetry of the cingulate gyrus and interictal epileptiform discharge lateralization in dogs with idiopathic epilepsy.
A mouthful, right.
Definitely a mouthful. So before we break it down, what jumped out at you when you first saw this?
Honestly, it's the way they dove into the actual structure of the brain, specifically looking at the cingulate gyrus and whether its size correlates to, which side of the brain those epileptic discharges were happening.
Okay, so not just where in the brain, but the physical structure itself. And why is that such a big deal? What could this mean for how we understand epilepsy in dogs?
Well, for me, it's the precision they were going for, that semi-automated MRI volumetry they're talking about. That's a really high-tech way of saying they can measure brain structures with incredible detail.
So we're talking about catching things we might have missed before.
Exactly. What if there are subtle differences, even in dogs diagnosed with idiopathic epilepsy, that we just couldn't see clearly before? This could be a game changer.
Okay, I'm hooked already. Let's break it down. We've got our MRI. We're using the super precise technique, and we're focusing on the cingulate gyrus. For those of us who might not have aced neuroanatomy, what's so special about the cingulate gyrus anyway?
Think of it like Grand Central Station, but for the brain. It's this central hub involved in so many crucial functions: emotions, learning, memory. It's all connected to the cingulate gyrus.
And this study found a size difference in this Grand Central Station in dogs with epilepsy. Okay, I need the details. What did they discover?
So they found that in dogs with idiopathic epilepsy, the cingulate gyrus on the same side as the epileptic activity, on average, it was about 30% smaller than on the opposite side of the brain.
30%. That's a huge difference. I mean, that's got to be significant, right?
Oh, yeah, that's a big deal. It wasn't just a tiny variation. This was a statistically significant difference.
Wow. Okay, so we've got this link between the size of the cingulate gyrus and epileptic activity, but the big question is WHY. What could explain a 30% size difference?
So there are a couple of possibilities. One theory is that the seizures themselves might actually be damaging the cingulate gyrus over time.
The seizures themselves are causing damage.
That's one thought. You can think of it like a path in the woods. The more you walk it, the more worn down it gets, right?
Okay, yeah, I get that. So repeated seizures could be wearing down the cingulate gyrus, making it smaller on that side. What's the other possibility?
This is where it gets even more interesting. The other possibility is that the size difference was already there, even before the seizures began.
So a smaller cingulate gyrus could actually be a risk factor for developing epilepsy in the first place.
Exactly. Yeah, that's a pretty wild thought, right? Instead of just treating seizures as they happen, what if we could identify at-risk dogs early on, just based on brain structure?
That would be incredible.
Hmm.
Talk about preventative care. But if we're saying a smaller cingulate gyrus could be present before seizures even start, it makes you wonder what's making it smaller in the first place, if there's something else going on.
That's the big question, isn't it? And it really highlights how complex epilepsy is. It's not just the simple switch flipping in the brain. This study is looking at the cingulate gyrus, but it's likely just one piece of a much bigger puzzle.
And like any good puzzle, sometimes it's the pieces that don't quite fit that give us the most important clues. Speaking of which, the study mentioned a couple of dogs where the cingulate gyrus on the side with the epileptic activity was actually larger, not smaller. Did they say anything about what was going on there?
They did. Those are interesting cases. Both of those dogs had their MRIs done relatively soon after a seizure. One was a month after, and the other was about 6 months after. So it's possible that there's some swelling or inflammation happening in the brain right after a seizure, which could temporarily affect the size of the cingulate gyrus.
So not a permanent size difference, but maybe something we might only see if we're looking at the brain really soon after a seizure.
Right. It just goes to show you really have to look at the whole picture, the timing of the MRI, the dog's history, all of it matters when you're trying to interpret these results. And speaking of the bigger picture, one of those dogs with the larger cingulate gyrus, he was on 3 different anti-seizure medications at the time of the MRI. Which brings us to another really important part of this study, drug-resistant epilepsy.
Yeah, because as we all know, epilepsy can be incredibly difficult to manage. So did the study find any connection between the cingulate gyrus and how well dogs responded to medication?
They did. The dogs with the biggest differences in cingulate gyrus size, those are the ones who are having the toughest time managing their seizures with medication. One dog had a difference of almost 220 cubic millimeters. That's huge.
220 cubic millimeters. Wow. For our listeners who might not be as familiar with brain anatomy, can you put that into perspective? How much bigger or smaller is that compared to a healthy dog's cingulate gyrus?
Well, it's hard to give a perfect comparison without getting too technical, but think of it this way. Imagine a small grape versus a small plum. That's the kind of size difference we're talking about. It really highlights just how significant these structural changes can be, especially when it comes to the severity of the epilepsy.
So the more severe the epilepsy, the more likely we are to see these really noticeable differences in cingulate gyrus size. That could be incredibly valuable information for figuring out the best way to treat each dog.
Absolutely. If we can identify these structural markers early on, it could completely change how we approach treatment. We might be able to personalize treatment plans from the start, even before seizures have a chance to become really severe.
This is all so fascinating.
Yeah.
And while this study focused primarily on the cingulate gyrus, I was curious, did they mention anything about what the EEGs were showing in terms of where the epileptic activity was happening?
Oh, yeah, definitely. The EEGs were a key part of this whole thing. They weren't just used to diagnose epilepsy, they were also used to pinpoint the location of those interictal epileptiform discharges, the IEDs.
Right, those abnormal brainwave patterns that happen between seizures, like little electrical storms brewing in the brain. So where were these IEDs most prominent? Was there any kind of pattern?
Interestingly, most of the discharges, whether they were happening on the left or right side of the brain, they tended to be clustered around the temporal lobe, specifically leads T3 or T4, depending on the side.
So for our visual learners out there, if you imagine a map of the brain, we're talking about the area right around the temples, hence the name temporal lobe. And if I remembered correctly, that part of the brain plays a big role in things like processing sounds and forming memories, right?
You got it. And it's actually a pretty common spot for seizures to originate, both in dogs and in humans. And given that the temporal lobe is so involved in things like memory and emotional processing, it makes sense that dogs with epilepsy often experience behavioral changes along with their seizures.
It's amazing how much we're learning about the connections between brain structure, electrical activity, and even behavior in dogs with epilepsy. But no study's perfect. Were there any limitations they mentioned that we should be aware of?
There was one that stood out to me, and it has to do with the MRI machine they used. They were using a 1.5 Tesla MRI, which is pretty standard in vet med.
Yeah, most of us are working with 1.5T machines,
Right. And it does a decent job, but human medicine, they're often using 3T machines.
which basically means
Higher resolution. Think of it like comparing a regular camera to one of those super fancy high definition ones. The 3T might be able to pick up on even tinier structural changes that we're just not seeing with the 1.5T.
so it's possible there's even more to discover, even finer details we could be missing just because of the limitations of the technology.
Exactly. Who knows what we'll find as imaging technology keeps advancing, right?
It's exciting to think about. Okay, so putting on our practical hats for a minute, what are the key takeaways from this research for our vet colleagues who are out there on the front lines treating dogs with epilepsy every day? What should they be thinking about?
Well, I think this study really drives home the importance of a thorough neurological workup. We're talking a detailed history, a complete neuro exam, and of course that advanced imaging, the MRI and the EEG.
And it sounds like we shouldn't just be looking for those big, obvious lesions on the MRI. We need to be paying attention to these subtler clues too, like differences in size, especially in areas like the cingulate gyrus.
Absolutely. Those subtle differences, they could be the key to understanding why some dogs respond well to treatment and others don't. And don't forget about the timing of the MRI. If it's done too soon after a seizure, those post-seizure changes could throw you off.
It's like we need to be detectives, piecing together all these different clues to give our patients the best possible care.
Could you have said it better myself? And research like this, it gives us the tools and the knowledge to be those detectives.
It's definitely given us a lot to think about today. I always learn so much from these deep dives. It's an incredible time to be in veterinary neurology, wouldn't you say?
100%. With every new discovery, we're getting closer to really understanding the complexities of the canine brain and providing our patients with the best possible care.
Well said. As always, thank you for listening to Vet NeuroJar. Keep your minds happy and tails wagging.